Welcome to another weekly edition of the Best Way to Smoke News, sponsored by none other than this glue gall. You get you that glue gall and you won't be smoking on no spit.
Oh,
This
no
news
bueno.
being presented to you by your favorite smoking partner, Serpo.
And Big J, make sure you stay elevated.
A little bit. Let's see what's cracking with these new homes. Homes in states with adult use cannabis significantly outpace home values in other states. Let's see what they talking about with this. The home values in states with adult use cannabis laws have increased on average over $60,000 more than the home values in states where cannabis remains prohibited. So they saying like pretty much the states that got it cracking is with the bud.
Right.
They going where it's legal at, you know what I'm saying? The home values is going up. Where it's potentially legal.
Right.
Almost legal. Home values in jurisdictions with access to legal adult cannabis over the past 15 years significantly outpace home values in areas where cannabis prohibition has remained in place. According to a recent analysis, the real estate platform Cleaver offers. The report judges the average home prices across the U.S. from 2009 to 2024 and found that the average value of homes in states with adult use cannabis, you know what I'm saying, policies in place, have increased by over $200,000. While the average value of homes in states where cannabis has remained illegal increased just slightly over $150,000. You know what I'm saying? A $60,000 difference, the author noted. Additionally, of the 10 states that saw the biggest average increase in home values, the only state without adult use cannabis reform on this list was Idaho. Meanwhile, only one state, which is Illinois, amongst the 10 states with the lowest increase in home values has enacted adult use reform. So pretty much, you know what I'm saying, the states that's having fun a little bit, that's a little bit relaxed, you know what I'm saying? Y'all, they all stand elevated. You dig?
Man, no question. Man. Leading health organization urged Congress to maintain protection for state medical marijuana laws. In a concentrated effort to safeguard patient access, a coalition of prominent health patient advocacy organizations is pressing Congress to maintain crucial federal protections for state medical marijuana programs. You know what I'm saying? These groups are emphasizing the vital role cannabis plays as a therapeutic option for millions of Americans suffering from a range of debilitating conditions. With the annual budget process underway, advocates are especially lobbying for the continued inclusion of the, what the heck is that? Roker Block Boom Amendment. You know what I'm saying? Hey, look, whoever whoever the engineer, who you call that get your paperwork together and all that? They messed it up, though. I can't see that shit, though, man. But look, the amendment, a long-standing rider that prevented the Department of Justice from using federal funds to interfere with states that have legalized medical cannabis. Their unified appeal comes at a crucial time as the future of federal cannabis policy remains a subject of intense debate in Washington. The coalition, which includes organizations such as Americans for Safe Access, the U.S. Pain Foundation, and the National Multiple Sclerosis Society, urges that disrupting these state-level protections would have severe consequences for patients. I agree, man. Let's keep the people that really need it, you know what I'm saying, because it is beneficial. Let's keep these people protected. You know what I'm saying? I'm one of them. I really need it. They highlighted that for many medical cannabis is not just a alternative, but often the most effective or even sole treatment option available for managing symptoms and improving quality of life. While a provision in a recently advanced House spending bill seeks to prevent the DOJ, we just talked about that though last week, the DOJ from rescheduling or descheduling cannabis, these health groups are focused on preserving the existing safeguards that shield state legal medical programs from federal intervention, ensuring continued access for patients across the country. And for those of y'all don't know, even before 2016, they had medical provisions in for cannabis already in certain states, though, especially California, though. You know what I mean? Yes, sir.
For sugar deal. Omaha Tribe of Nebraska passes adult use medical cannabis legalization. The Tribal Council of the Omaha Tribe of Nebraska has voted unanimously to legalize both adult use and medical cannabis, positioning the tribe as a trailblazer in state cannabis reform. That's a big old win, a big old salute from me to y'all. Medical, mandatory, adult use, good looking out. The Omaha Tribe of Nebraska is the first government in Nebraska to legalize and regulate both medical and adult use cannabis following a unanimous vote by the Tribal Council. Meanwhile, Nebraska voters approved a statewide medical cannabis legalization initiative last November, but lawmakers this year ultimately failed to pass the legalization implementing the program. According to the Omaha Tribe of Nebraska Attorney General John Cartier, the Omaha Tribe is not waiting on a broken system to deliver. They paving their own way. We got it. You know what I'm saying? We are asserting our sovereign right to govern, protect our community, and build a sustainable economy that reflects our values. I just want to read that one more time because this is from, you know what I'm saying, one of the tribal members. We are asserting our sovereign right to govern, protect our community, and build a sustainable economy that reflects our values, meaning, you know what I'm saying, to them. I believe that should be placed like everywhere, you know what I'm saying, within our cultures, period. The new law will establish a cannabis regulatory commission to oversee the tribal adult use and medical cannabis industries. The adult use program will be open to adults aged 21 and over, including non-tribal visitors on reservation land. And regulators with the commission will oversee the cannabis licensing process, product testing, and enforcement systems. That's kind of dope, you know what I'm saying? Because there was a time, like in my past, I went on a reservation. On that reservation, they have their own, like, security, police, whatever you want to call it. You know what I'm saying? And they wasn't like cannabis friendly at the time. You know what I'm saying? Nothing against it. It was just like within our laws, you know what I'm saying, it's prohibited.
Right.
You know what I'm saying? So they was like, you know what I'm saying, to actually blow, if you cross a certain street, you know what I'm saying, you're no longer, you know what I'm saying, on tribal lands. Right. You know what I'm saying? And you won't be like violating our laws, but cross that street, you straight. So right here, you know what I'm saying, even for non-tribal members, you can come. You can get elevated.
Get elevated. Boom, boom, boom. Federal paradox. U.S. database acknowledges cannabis as medicinal, while federal law maintains Schedule I status. I'm on these political policies and all this, though. You know what I'm saying? A perplexing contradiction continues to define the federal government's stance on cannabis. It's very confusing. With an official U.S. Department of Agriculture database now explicitly describing marijuana as having medicinal uses, even as the substance remained classified as a Schedule I drug under the Controlled Substance Act. This federal designation traditionally reserved for substances with no currently accepted medical use and a high potential for abuse, stands as a strict contrast to the information found within Dr. Duke's database, a widely reinforced USDA guide on plant-human interactions. The entry specifically notes that THC, the primary component of cannabis, is associated with therapeutic actions for various conditions, including pain, convulsions, and glaucoma. This eternal inconsistency within federal agencies highlights the growing disconnect between scientific understanding, public sentiment, and outdated federal policy. The USDA's acknowledgement of cannabis medicinal properties aligns with numerous state-level medical marijuana programs and a growing body of research from institutions like the National Institute of Health, which has also acknowledged evidence of cannabis therapeutic potential for pain and other uses. Despite recommendations from the Department of Health and Human Services to move cannabis to Schedule 3, a less restrictive category, the Drug Enforcement Administration, DEA, has yet to finalize such a change, leaving cannabis in a federal limbo that continues to hinder research, legitimate commerce, and patient access, man. I'm gonna keep beating this I just keep beating this. Pop, 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 pop. Come on, man. Come on, man.
I ain't gonna waste my time because they ain't gonna pass now. House spending bill provision seeks to block cannabis rescheduling process. GOP lawmakers in a key House committee are pushing a spending bill provision that will prevent the Justice Department from spending any funds on rescheduling cannabis under federal law. But it is the second year in a row that the government lawmakers have included the provision in the spending bill for federal commerce, justice, science, and related agencies. The effort directly counters the federal rescheduling process that the Biden administration formally kicked off in 2024, and which President Trump vocally supported during his second presidential campaign. The rescheduling process, however, may have stalled out permanently under the second Trump presidency after a DEA judge counseled long-anticipated hearing for expert testimony on the issue. And in April, an unnamed White House official said the administration had no action plan for cannabis policy update. You know what I'm saying? So that's why I'm just like, when they keep coming to this reform, reschedule, however it may be, I'm like, man, all right, I'm just going to continue to smoke with your favorite smoking partner.
Man.
Myself.
Man.
All right, so Section 607, none of the funds appropriated or otherwise made available by this act may be used to reschedule marijuana. As such term is defined in Section 102 of the Controlled Substance Act, 21 USC 802, or to remove marijuana from the schedules established under Section 202 of the Controlled Substance Act. So pretty much, they ain't trying to change nothing, bro.
They keep waving. Look, they keep waving that flag and saying they're gonna do this and saying they're gonna do that. Though, look, I'm one that believes I want to see certain things happen for businesses. You know what I'm saying? For us as the consumers, for just for the industry, period, and for the community, it need to be some kind of change that's really gonna help and be a benefit. You know what I'm saying?
Yep. And that's your weekly news with your favorite smoking partner, Surfbo Jr.
Make sure you stay elevated with Big J.
And baby.